If you're a black man over 50, listen carefully. You're at higher risk for enlarged prostate than other men. A staggering 62% of West African men aged 50 to 74 are affected. And if you have BPH, you're 2.2 times more likely to also develop prostate cancer than white men. But here's the problem. You're half as likely to be diagnosed, often getting treatment only when the disease is severe. I'm Dr. Anim. In the next few minutes, I'll tell you what you need to know to protect yourself. Let's go. So what is BPH? BPH stands for benign prostatic hyperplasia. It's a non-cancerous enlargement of the prostate gland. As your prostate grows, it squeezes the urethra, making urination difficult. So why are black men at a higher risk? Well, it's a mix of biological and health factors. Biologically, genetic differences in androgen receptors mean your prostate might respond more strongly to testosterone. You may also have higher levels of DHT, the hormone that makes the prostate grow, larger baseline prostate sizes, and more prostatic inflammation. Then there are the health factors. 50% of black men are obese, compared to 42% of white men, and obesity can increase BPH risk by 80%. Diabetes is twice as common in black men, and it worsens BPH. Higher rates of hypertension also worsen symptoms. On top of this, there's healthcare disparity. Black men are diagnosed half as often despite having symptoms. And when they are diagnosed, the disease is more severe. About 12.9% of black men need surgery versus 9.1% of white men. This isn't because the disease is different, it's because the diagnosis comes too late. The symptoms are the same for everyone. Waking up 2 or more times at night to urinate, a weak stream, difficulty starting, a feeling of incomplete emptying and urgency. What's critical for black men to understand is this: while BPH is not cancer, African Americans with BPH have a 2.2 times higher risk of also getting prostate cancer. So screening is absolutely crucial. Now let's do some quick myth busting. Myth: BPH causes prostate cancer. Fact: no, it doesn't. But remember, black men with BPH have a 2.2 times higher cancer risk, so you must get screened. Myth: black men just have bigger prostates. There's nothing to do about it. Fact: this is a dangerous myth. Larger prostates need more attention, and we have effective treatments. Myth: it's just aging, especially if my dad had it. Fact: family history does increase your risk 4 to 6 times, but 70 to 80% of men improve with medication. Don't just accept suffering. Myth: I'm under 50, so I don't need to worry. Fact: black men should start screening discussions at age 40 to 45, not 50. And finally, myth: doctors always dismiss black men's symptoms. Fact: unfortunately, this does happen. That's why you must advocate for yourself. Insist on an evaluation and get a second opinion if you need to. The good news is that treatments work equally well for all races. Let's talk solutions. Prevention should start in your 40s. Weight loss is critical. Even losing 10% of your body weight helps. Aim for 150 minutes of exercise weekly to reduce your risk of diabetes, high blood pressure, and inflammation. Control your diabetes and blood pressure, as both are more common in black men and worse in BPH, and adjust your diet: more plants, tomatoes, and less processed food. For medications, we see a 70 to 80% success rate. Alpha blockers like tamsulosin or doxazosin offer fast relief in days to weeks by relaxing the prostate muscles. Fun fact: if you're already on doxazosin for blood pressure, it helps both conditions. Then there are 5-AR, is like finasteride or dutasteride. These actually shrink the prostate by 20 to 30% over 3 to 6 months, and are best for the larger prostates often seen in black men. It's important to know they lower your PSA level by about 50%, so your doctor needs to account for that when screening for cancer. Combination therapy, using both types of medication, is 66% more effective and is recommended for larger prostates. When needed, procedures and surgery like Urolift, Reserm, laser, or TURP have 85 to 90% success rates. Black men are more likely to need surgery, but this is often due to late diagnosis. The key is that early treatment prevents progression and the need for surgery. Don't wait. So for black men, here is your action plan. At age 40 to 45, start screening discussions with your doctor. This means an annual PSA test and a digital rectal exam. This is not optional for you. You are at higher risk. If you have any urinary symptoms, see a doctor within a month. Don't wait for your annual physical, and don't accept it's just aging as an answer. If you're waking up 2 or more times a night, this is considered moderate disease and needs treatment. See your doctor this week. And if you can't urinate at all, that's an emergency. Go to the ER immediately. Here's how to advocate for yourself. Be specific with your doctor. Shay, I wake up 3 times nightly to urinate. I have a weak stream and difficulty starting. Request the necessary tests. I want a PSA test, a digital exam, and a symptom score evaluation. Know your family history and share it. My father had prostate issues. If you feel dismissed, say this. Given my race and family history, I'm at high risk. I need a referral to a urologist, and always get a second opinion if your symptoms persist without adequate care. Ask your doctor these questions. What is my prostate size? What is my PSA level? Do I need cancer screening? What treatment do you recommend? And what if this treatment doesn't work? Do not accept dismissive answers like you're too young, it's just aging, or come back if it gets worse. You deserve timely, effective care. Insist on it. Let's do a quick recap for black men. You have a higher risk, with 62% of West African men aged 50 to 74 affected. You face a 2.2 times higher cancer risk if you have BPH. You need to start screening at age 40 to 45, not 50. You are often diagnosed later, so you must be proactive. Control your weight, diabetes, and blood pressure. Treatments work with 70 to 90% success rates. And most importantly, advocate for yourself and insist on proper care. The bottom line is, your risk is higher, but this condition is treatable. Don't wait. Don't accept poor care. You deserve to sleep through the night and live without constant trips to the bathroom. Subscribe for more content on black men's health. Share this video with your family and friends. And comment with your questions below. I'm Dr. Anim. Take control of your health. See you next time.